Picture this. You're feeling fine, maybe walking every day, eating what you think is healthy, and your doctor says your labs look normal. But one day, out of nowhere, a heart attack strikes. Without warning, without chest pain, without shortness of breath. For half of seniors, that's how heart attacks start, sometimes with sudden death as the first sign. It's not because you skipped your checkups or don't have a doctor. It's because most doctors aren't looking for the real culprit: soft plaque. This sneaky, unstable buildup in your arteries grows quietly, then ruptures suddenly, triggering heart attacks or strokes. The scary part? Your body might already be sending you clear signals. You just need to know what to look for. Today, I'm sharing 5 silent signs of soft plaque that I check for in my patients, signs that could save your life. I'll also walk you through a proven protocol we've used with hundreds of seniors to detect, monitor, and even reverse this risk. Plus, I'll tell you about Gene, a retired engineer whose curiosity uncovered these signs just in time. Stick with me, because the last sign, believe it or not, has to do with your ears. Let's dive in and take control of your heart health. Sign 1. Gingivitis and bleeding gums. First up, let's talk about something you might notice at the dentist, or even in your bathroom mirror: bleeding gums, redness, or tenderness, also known as gingivitis. You're brushing, maybe flossing, but your gums still bleed or feel sore. You might think, I just need a better toothbrush or a cleaning. That's what Gene, our retired engineer, thought. He was diligent about oral hygiene, but his gums kept bleeding. His dentist brushed it off as normal aging. Here's the reality. Gingivitis is incredibly common. Studies show up to 75% of adults over 65 have some form of gum disease, but it's not normal or healthy. Gingivitis is one of the earliest red flags for chronic inflammation, the driving force behind soft plaque in your arteries. The root cause often lies in prediabetes or insulin resistance, where your body struggles to process carbohydrates, leading to high blood sugar and inflammation. According to the CDC, 38% of adults over 65 have prediabetes, and most don't know it. High blood sugar feeds harmful bacteria in your mouth, while inflammation weakens your immune system's ability to fight them, making your gums prone to infection. A 2018 study in the Journal of Periodontology found that people with gum disease are 2.5 times more likely to have cardiovascular disease. Here's how it connects to your heart. The same inflammatory chemicals causing gum issues, like interleukin-6 and TNF-alpha, travel through your bloodstream, damaging the delicate lining of your arteries, called the endothelium. This creates a perfect environment for soft plaque to form. Unlike hard plaque, which builds slowly and is more stable, soft plaque is inflamed and prone to rupturing, which can block an artery and cause a heart attack or stroke. For Gene, bleeding gums were his first clue. When we tested him, a glucose tolerance test revealed early insulin resistance, catching the problem before it became a heart attack. Actionable advice for seniors. If your gums bleed when you brush or floss, don't chalk it up to poor hygiene. Schedule a dentist visit to rule out severe gum disease, but also ask your doctor for a 2-hour oral glucose tolerance test, OGTT, to check for insulin resistance. At home, reduce inflammation by cutting sugary snacks and refined carbs like white bread, pasta, or pastries, which spike blood sugar. Add anti-inflammatory foods like leafy greens, spinach, kale, berries, and fatty fish like salmon or mackerel, which are rich in omega-3s. Use a soft bristled toothbrush and floss gently daily to avoid irritating your gums. Consider a water flosser if traditional flossing is tough on your hands. Sign 2. Hair loss on lower legs and feet. Next, Let's look at something you might notice when you're putting on socks or looking in the mirror. Hair loss on your lower legs, shins, ankles, or toes. This isn't about shaving, waxing, or tight socks. It's about hair that stops growing back altogether. You might think, I'm just getting older, or assume it's no big deal, but this could be a sign of compromised circulation. Healthy blood flow keeps hair follicles alive, delivering oxygen and nutrients through tiny capillaries. When plaque builds up in the arteries supplying your legs, those capillaries shut down, and hair stops growing. A 2017 study in Circulation linked hair loss on the lower legs to peripheral artery disease, PAD, which affects 20% of seniors over 70, according to the National Heart, Lung, and Blood Institute. Psoriasis isn't just a leg problem, it's a sign of systemic atherosclerosis, meaning plaque is likely building in your heart or brain arteries too. Soft plaque, the unstable kind, increases your risk of a heart attack or stroke. Gene was active, walking daily and even jogging occasionally, but he noticed his shins were smoother, with less hair than before. Combined with his gum issues, this prompted him to get tested, revealing early PAD and soft plaque. Actionable advice for seniors. Take a moment to check your lower legs for hair loss or shiny, thinning skin, especially if it's new or unexplained. Ask your doctor for an ankle brachial index, ABI test, a quick, non-invasive test that compares blood pressure in your ankles and arms to detect PID. To boost circulation, aim for 20 to 30 minutes of walking daily, ideally after meals, to improve blood flow and blunt glucose spikes. If walking is tough due to joint pain, try chair exercises like leg lifts or seated marches. Consider compression socks to support circulation, but check with your doctor first. Eat nitrate-rich foods like beets, spinach, or arugula, which dilate blood vessels, and avoid smoking, which damages arteries. Sign 3. Rising resting heart rate and falling HRV. Now, let's talk about something your fitness tracker might already be picking up: a rising resting heart rate or declining heart rate variability, HRV. If your resting heart rate, say 60 beats per minute when you're relaxed, starts creeping up to 65, 68, or into the 70s over months, even though your routine hasn't changed, that's a warning sign. Similarly, HRV, the variation in time between heartbeats, shows how flexible your nervous system is. A higher HRV, 40 to 60 milliseconds for seniors in good shape, means your body handles stress well. A lower HRV, below 30 milliseconds, signals strain. A 2020 study in Frontiers in Cardiovascular Medicine found low HRV is linked to a 30% higher risk of heart attack in older adults. Your resting heart rate and HRV are controlled by your autonomic nervous system, which balances fight or flight, sympathetic, and rest and digest, parasympathetic modes. Chronic stress from inflammation, poor sleep, or insulin resistance shifts you into fight or flight mode, raising your heart rate and lowering HRV. Insulin resistance, affecting over a third of seniors per the CDC, triggers this by increasing stress hormones and inflammation, which damage the arterial lining, endothelial dysfunction. Gene's Apple Watch showed his resting heart rate climbing from 62 to 68 and his HRV dropping below 30. He felt fine, but these trends led us to run tests that found early plaque and metabolic issues. Actionable advice for seniors: use a fitness tracker like an Apple Watch, Fitbit, or Oura Ring to monitor your resting heart rate and HRV. Track trends over weeks, not just daily numbers, as single readings can vary. If your resting heart rate is rising or HRV is dropping, ask your doctor for an inflammation panel, including high-sensitivity C-reactive protein and an OGTT. To improve HRV, Practice slow, deep breathing for 5 minutes daily. Inhalation for 4 seconds. Exhalation for 6. To activate your parasympathetic system. Aim for 7 to 8 hours of consistent sleep in a dark, cool room, avoiding screens and alcohol an hour before bed. If mobility is limited, try seated breathing exercises or gentle stretching to reduce stress. Sign 4. Erectile dysfunction, ED. This one's tough to discuss, but it's critical for men. Erectile dysfunction. ED is common. About 40% of men over 60 experience it, per a 2019 Journal of Sexual Medicine study. But it's not just about aging or low testosterone. More often, it's a vascular issue, where plaque narrows the small arteries involved in erections. These arteries are smaller than those feeding your heart, so they show problems first, sometimes years before a heart attack. A 2016 American Journal of Cardiology study found men with ED have a 60% higher risk of cardiovascular events. The root cause is often insulin resistance, which damages the endothelium, making arteries stiff and less able to deliver blood. This endothelial dysfunction also promotes soft plaque formation. Gene noticed ED starting slowly in his late 50s. His doctor offered a prescription, but no one mentioned heart risk. When we tested him, we found soft plaque and early metabolic issues, which could have led to a heart attack if ignored. Actionable advice for seniors. If you're experiencing ED, don't settle for a quick prescription. Ask for a coronary artery calcium, CAC, scan, or carotid intima media thickness, CIMT, test to check for plaque. Address insulin resistance by cutting processed carbs, soda, cookies, white rice, and eating within an 8 to 10 hour window, like 10 a.m. to 6 p.m., to reduce insulin spikes. Incorporate strength training 2 to 3 times weekly. Try body weight exercises like chair squats if weights aren't an option, to boost blood flow and insulin sensitivity. Discuss with your doctor if supplements like L-arginine, 1 to 2 grams daily, which supports blood vessel relaxation, are safe for you. Low testosterone may play a role, so ask for a hormone panel, but prioritize vascular health first. Sign 5. Earlobe crease, Frank's sign. Finally, the oddest sign. A diagonal crease on your earlobe, known as Frank's sign. It runs at an angle from the ear opening to the lower edge. Not everyone with a crease has heart disease, and not everyone with heart disease has a crease, but a 2014 Heart Journal analysis found a 40% higher risk of cardiovascular disease in those with it. Researchers believe it's linked to microvascular damage from high blood sugar, insulin resistance, or inflammation. The same processes affecting your heart, brain, kidneys, and eyes. The earlobe, with its tiny blood vessels and little collateral flow, shows this damage visibly. Gene spotted a crease on one earlobe during a routine check in the mirror. Combined with his other signs, bleeding gums, leg hair loss, rising heart rate, and ED, it prompted us to run a CIMT scan, which confirmed soft plaque. This visible clue was a critical wake-up call. Actionable advice for seniors. Check your earlobes in a mirror for a diagonal crease. If you see one, especially alongside other signs, ask for a CIMT scan or advanced lipid panel to assess plaque and lipid particle size. Reduce microvascular damage by limiting alcohol, which spikes blood sugar, and eating antioxidant-rich foods like blueberries, cherries, or dark chocolate, 70% plus cocoa. Try a 10-minute daily walk in nature or a park to lower inflammation and stress, which is especially beneficial for seniors. If you wear glasses, ensure they don't press on your earlobes, as this can mimic a crease. What to do next? A protocol to reverse risk. Spotting these signs is just the beginning. Here's the protocol we use with seniors to detect, monitor, and reverse soft plaque, tailored to your needs. Get the right tests. CIMT scan, a non-invasive ultrasound measuring arterial wall thickness and detecting soft plaque. It's more sensitive than a stress test for early risk, per a 2020 Journal of the American College of Cardiology study. Oral glucose tolerance test, OGTT, tracks blood sugar and insulin over 2 hours to catch prediabetes early. A 1C misses 20% of cases, according to a 2021 diabetes care study. Inflammation panel measures high sensitivity C-reactive protein, CRP, LPPLA2, and myeloperoxidase for arterial inflammation. A urine microalbumin creatinine ratio checks kidney vessel damage, a key early marker. Advanced lipid panel analyzes LDL particle size and HDL function, not just total cholesterol. Small, dense LDL particles are more dangerous, per a 2018 atherosclerosis study. Track trends. Use a fitness tracker to monitor resting heart rate and HRV. Log weekly trends to spot patterns. A rising heart rate or falling HRV signals stress. Share this data with your doctor for context during testing. Change your lifestyle. Lower insulin load. Avoid ultra-processed carbs, white bread, soda, chips, and eat within an 8 to 10 hour window to reduce insulin spikes. Prioritize whole foods, vegetables, broccoli, cauliflower, lean proteins, chicken, fish, nuts, almonds, walnuts, and low glycemic fruits, berries, apples. A 2022 nutrient study showed time-restricted eating improves insulin sensitivity in seniors. Move smarter. Combine daily walks, 20 to 30 minutes, post-meal if possible, with strength training, 2 to 3 times weekly, e.g., chair squats or resistance bands, and high-intensity interval training. HIIT. Like 3 sets of 30-second fast walks, followed by 1-minute slow walks. HIIT rebuilds capillaries and boosts insulin sensitivity, per a 2020 sports medicine study. For joint issues, try low-impact HIIT, like seated cycling or water aerobics. Prioritize recovery. Aim for 7 to 8 hours of consistent sleep in a dark, cool room, 60 to 67 degrees Fahrenheit. Avoid alcohol and screens an hour before bed to protect deep and REM sleep, critical for arterial repair. A 2019 sleep medicine study linked poor sleep to a 25% higher risk of cardiovascular events in seniors. Manage stress. Practice 5-minute deep breathing daily, 4-second inhale, 6-second exhale, to lower cortisol. Take short breaks to reset. Step outside, listen to calming music, or journal gratitude. Chronic stress fuels inflammation, per a 2019 Nature Reviews cardiology study. Consider targeted supplements. Based on your labs, magnesium, 400 milligrams daily. Regulates blood pressure, omega-3s, 1 to 2 grams daily. Reduce inflammation, and berberine, 500 milligrams before meals, improves glucose control. CoQ10, 100 to 200 milligrams daily, supports energy metabolism, especially if on statins. Always consult your doctor before starting supplements. Monitor progress. Retest every 6 to 12 months to track plaque, inflammation, and insulin levels. Consistency matters more than perfection. Gene followed this protocol, reducing his insulin resistance and stabilizing his plaque within a year, avoiding a potential heart attack. Gene's story, a life saved. Let's revisit Gene, our retired engineer. He wasn't a patient when he started noticing these signs: bleeding gums, hair loss on his shins, a rising resting heart rate, ED, and an earlobe crease. He could have dismissed them as aging, like his doctors did. But Gene got curious after watching a video linking these signs to heart disease. His CIMT scan showed soft plaque, and his OGTT revealed insulin resistance. By cutting processed carbs, adding HIIT and strength training, prioritizing sleep, and taking omega-3s and magnesium, Gene reversed his risk. Today, he's thriving with more energy, better sleep, and confidence that he's protecting his heart for the long haul. Why this matters for seniors' heart disease is the leading cause of death for seniors, claiming 1 in 4 lives, according to the CDC. Soft plaque is sneaky, but it's reversible with early action. These signs, bleeding gums, leg hair loss, rising heart rate, low HRV, ED, and earlobe creases, are your body's whispers. Listen to them before they become screams like a heart attack or stroke. You don't need to overhaul your life overnight. Small, consistent changes can rebuild your arterial health from the inside out. Watch our next video for the full step-by-step protocol to clean your arteries and protect your heart. Click now to take charge of your health.